whatever we do, whatever we eat, wherever we live, we will become sick one day. Yes, we all will die. But we are not ready to accept that truth, aren't we? We're in a corner of a circle and we all blinded.
Palliative care is not a place, it is a philosophy. It can be delivered anywhere. It could be in the ward, ICU, dialysis unit, or in the home. Palliative care is not just about the last few days of life. It is about improving the quality of life for anyone who has advancing and progressive illness. Palliative care is about celebrating the life.
Palliative care is a new concept in most of the developing countries. So we have to train health professionals in this field. Nearly 2/3 of our cancer patients present with advanced malignancies. There is no intention of cure in this situation.
Hi, Mr. Kumaran. I am calling from hospital. Today is your wife's appointment.
Actually, today is our second meeting. Just to remind that where we are. 2 weeks back came with pain in the neck and difficulty in mouth opening. Can you remember that?
Yes, doctor. Is there any bad news?
I have gone through all the scans. According to the scans, the cancer has gone everywhere. It has gone to the lungs, liver, and backbones. It is very, very bad cancer.
So cancer and the terminal illness are giving lot of shock and unpredictable things in their life. So they need to overcome that shock through psychological process as well as the spiritual meaning. So people suddenly they respond in a shock manner and they try to understand the illness and try to understand the disease process and the outcome. So immediate reaction will be subside in some time with medication plus psychological intervention and the spiritual meaning. So people have to face this with all these equipment to face the terminal illness.
Doctor, is there any treatment for that?
Actually, your case was discussed with many experts. There is a team called Palliative Care Team. Do not get frustrated. There is an option called palliative chemotherapy and radiotherapy, which can be given at this stage. but we can't cure. But the palliative care is a new concept. It offers a lot of treatment and a lot of relief for your suffering.
Doctor, what are the benefits of that?
As a palliative care team, we will give maximum care for you. Your pain and other physical symptoms will be controlled. Also, you will be given the psychological care. Basically, it is improving your quality of life. That is the real advantage of palliative care.
So, palliative care is a good relief for us.
When it comes to terminal disease, we have talked about death, but it is one of the least speaking subjects in our society. Talking about it brings fear. But my view in palliative care is that dying people are still living. So we can do a lot of things to keep them comfortable until they die. This is called good death. Anyone doesn't like to die with pain and suffering.
Cancer and the terminal illness causes lot of psychological distress in the mind as well as the existence meaning in their mind. So the psychological intervention mainly involving acceptance of the illness and acceptance of the treatment as well as the outcome of the illness. So sometimes it's more than the psychological one, it is more than the spiritual thing. So spiritual meaning also giving lot of impact in their outcome as well as the pathway. So out of this main disease process, they need to overcome their stress as well as the meaning.
Advanced care planning is a very important component of palliative care. The patient's whole life journey is visualized with his or her terminal disease. Relevant issues including treatment options, resuscitation, financial planning, family arrangements, and end-of-life care options are discussed. Instead of big hopes, we discuss the small hopes and prepare the patient for a safe landing instead of a crash landing. It is about living the life to its possible maximum.
Communication in palliative care is very important. We should be honest with the patient about the disease, and it's better to answer in simple ways so that the patient and the relatives can understand. A comforting word which makes a real difference. Use right words in right tone and pitch with the right attitudes.
But we can give them best comfort through various measures like radiotherapy, chemotherapy, and other medications. Most of the symptoms can be treated in local setup if the medications are available, mainly the opioids. There should be trained staffs in these local hospitals so that this is convenient for the patients and the families too.
My palliative care team is very good. They are always with me. I never feel that I am alone. They are looking after my every problems. So I am not afraid to die. Their support gives strength for me. I am so worried about my sweetheart. This is my faith and it is God's choice.
In palliative care, focus is not dying, the focus is on living. Yes, because most people want to live, aren't they? And we can help them to do that. There will be people to support their families afterwards. Palliative care does not end after someone's dead. We are walking with the families in their journey of life.